Good morning, everybody. Okay, it's time to thrive. How to think well, eat well, and move well. I'm Dr. Khalid Alibhai here from Stewart Chiropractic in Surrey, BC. And we've got Shabita, Teja, Dr. Shabita Teja, a naturopath from Sinclair Wellness in Vancouver, and Dr. Shahana Alibhai, family doctor and stress and anxiety expert in Abbotsford, BC. Thank you so much for being here. We know that this is a challenging time, but we truly believe that we don't just have to survive, that we really can thrive. And now's the time to make a change. And if we can work on ourselves, then that way we can serve other people. We're going to get straight to it. I want to start talking about a few things right off the bat here, which is moving well. We have different listeners coming in that are logging in right now from all over Canada and even the USA. I want to thank everybody for being here. The problem that we're facing right now, and I want everybody to ask yourself this, is either our health is going up or down. Either we're heading in a direction of better health or poor health. And this is the decision that we need to ask, or the question we need to ask ourselves is, which way are we trending? Ask yourself this: can I be healthier next year than I am this year? And if you can say, yes, that's possible, then truly we don't have to use that excuse that as we get older and we get unhealthier, we do have a choice. And the problem that we're having is that we're trending in an era where obesity from 1970 has doubled. The rates of obesity have doubled. And I'm looking at my notes here that 2/3 of medication worldwide are actually consumed in North America, many of them prescription pain medications. 40% of children and youth age 5 to 17 meet the recommended physical activity of 60 minutes of moderate to intense, vigorous physical activity a day. And here's the astonishing stat. What is the #1 disability? I know I'm a chiropractor, but what's the #1 disability that affects our planet right now? It's lower back pain. Canada, in particular, spends $6 to $12 billion a year on medical costs for lower back pain. So we have to ask ourselves, which way are we going? And one of the biggest causes as a chiropractor that we've identified is sitting. And we all do it a lot throughout the day. We all do it often. But what's the average number of hours somebody will sit in a day? It's actually 11. 5 of those consumed by the TV. There was a study of 184,000 participants done in 2010, that people who spent more than 6 hours per day sitting with low levels of physical activity have a 71% increase in mortality rate. So the question I have for you is, if all these conditions that we're putting ourselves is creating more use for drugs or surgeries, think of the analogy that if you had a problem and you had an emergency and you called the fire department, right? They had to put out the fire, and we'll call that drugs or surgeries in our body. And they came in and they took out the fire. What do they do that with? Hoses and axes. They knock down the walls, they put the fire on our body, whether that's drugs or surgery. So now when we have to repair things in that home, do we call the fire department the next day? Or do we call the repair and maintenance? So now I want you to think about, how can we repair and maintain our body? Because we're so used to calling the fire department again, asking them to put out the fires in our body. When the fires are gone, we just gotta fix the solution. And so when I talk about sitting, I want you to know that not only is it an epidemic outside of what we're dealing with right now, that 4 to 7 hours of moderate to vigorous, 5 to 6 hours a day of watching TV actually increases our mortality rate by 50%. And a study of 9,000 middle-aged women sitting for more than 7 hours daily increases the risk of depression by 47%. So we have to ask ourselves, what are we going to do? And I have the solution for you. And the studies have been very clear. And I want you to, if you could just take away one component of my talk today, is micro breaks. there's a phenomenal study that was released that those who get up every 30 minutes for 2 minutes of sitting can reduce your risk of death by almost 33%. That is a phenomenal stat. So micro breaks are an important component of everyday living. So whether you're stand all day or you're sitting, take 2 minutes every 30. So 30 and 2, and you are proven to live longer. I have a great story about my father-in-law who had difficulty sitting on the ground to pray, and often what he would do was attempt to get on the ground and sit cross-legged, and he just couldn't do it. He couldn't sit for more than a minute cross-legged without being in severe pain in his lower back. So what did he do? Well, he moved into action. As a pharmacist, he actually stands all day, got in his car, got to his office, stood all day, got back in his car, came back, had dinner, sat for dinner. After dinner, sat down, watched TV, still sitting or standing all day, had never touched the ground. My challenge for you is to start spending more time sitting on the ground, because with all this sitting that we're doing, our hips are getting so locked up and bound up and tight that we've lost the mobility in our hip and they've become very rigid. If you look at people in a lot of Asian countries, they're sitting and eating on the ground, and they have less incidence of knee arthritis, hip arthritis, lower back pain, because they're getting on the ground more often. So make it an effort to spend more time, whether it's eating on the ground or playing with your grandchildren or your kids, because that's actually going to keep you healthier. We may think of it as an effort, but in the future, when you're in your 80s or 90s, if one of us falls down, we want to be able to get off the ground by ourselves. So start thinking about the next few decades or longer. One of the most important things that we talked about before is being able to get your heart rate up. We know that when you get your heart rate up, there's an instant release of dopamine and serotonin in the body that really releases those happy hormones. And once your body's in motion, you've got enough blood vessels in your whole body. And if you were to tie them all up and add them up, they would circle the entire globe. Once you get that blood pumping through there, you're going to bring your body to a different state. And a lot of us kind of feel stuck right now. And one of the best ways is to get your heart rate up. And my last tip for you, outside of micro breaks, stretching, sitting and standing when you're working, getting a sit-to-stand desk, and getting on the floor more, is really making sure that your head is right, but also that your diet's in the right place. And that's where Shabita is going to start talking about. She's a naturopath, and she's also a pharmacist. She's dealt with years of her own chronic pain, and I'm so proud of her in particular because she's so committed to helping others that despite her own challenges, a 4-year program actually took her 10 years, but she kept going because of how committed she is to helping others. So we're going to take it away with Shabita right now, and we're going to talk about the naturopathic component of eating well so that you can thrive. Shabita, go ahead.
Thanks, Khalid. I'm so excited to be here and share my passion with everybody that's tuning into the webinar. And thank you for tuning in. I know it's a really stressful time in our globe right now. We're all dealing with a great deal of stress, a great deal of trauma and grief. And so what I'm going to talk about today is how we can actually thrive and heal our mind by healing our gut. And what I see time and time again are patients in front of me that have 2 big issues. And if you go to the next slide there, stress and digestion. So as Khalid said, I am a pharmacist and naturopath. I practice at St. Clair Wellness Center in downtown Vancouver. And I also see patients out of PharmaSave in Abbotsford. So I try to offer telemedicine visits as often as possible, especially now. It's quite often. It's actually the full extent of my practice. But when a patient is across the video or across the chair, what I ask them is, what is your most bothersome symptom? What is your chief concern? And very often I want to get to the root cause. And the root cause can be summed up into one word, and that is stress. So I asked that patient, can you rate your stress on a scale of 0 to 10? 0 being no stress at all, and 10 being the most amount of stress you've ever experienced. I say, what is that number sitting in that chair right now? So if it's a 3, if it's an 8, the next question I ask is, what are your biggest stressors? For many, it can be financial, relationship. Is it physical stressors? Is it the fact that you have the most bothersome symptom, abdominal pain, digestive disturbance, eczema, psoriasis, depression, anxiety? Is that contributing to your stress? And is that causing it to be an 8 out of 10 instead of a 1 out of 10? And then I ask patients general markers of health. So that includes not only stress, but what their digestion looks like, what their appetite looks like, sleep, temperature, energy, exercise. We call that the general markers of health because I'm taking their subjective symptoms, what they're telling me, and combine it with the objective measurements, what I find, what their vitals are, what their physical exam looks like, combine it together. And then I'm trying to get to that root cause. And so digestion for me, we get into it pretty quick. And I ask about bowel movements. So I'm asking, what do your bowel movements look like? First of all, what are you eating throughout the day? What does breakfast, lunch, and dinner look like? Then what do your bowel movements look like? Because that gives me a really good idea of how well they're eliminating. So are they easy to pass? Are they formed? Do you have any blood, mucus, undigested food in your stool? And then what I'm asking is, what are you doing at the time of your meals? And you'll see in a little bit why that's important. Are you eating on the go? Are you chewing thoroughly? Are you stressed when you're eating? Are you on a conference call and trying to wolf your lunch down? All of these play a vital role. And so what Khalid has put up here is the autonomic nervous system. Though there are two components to that, and that's the sympathetic nervous system and then the parasympathetic nervous system. Basically, fight or flight and rest and digest. They're two opposite ends to the autonomic nervous system. And we can either be in one or the other, not both. So you can see this gazelle running on the picture here, speeds of 97 kilometers an hour, getting chased by maybe a lion, maybe a tiger. Their sympathetic nervous system is in overdrive. They're in sympathetic dominance. Hi, Shahana. You can see her logging in here. So they're in sympathetic dominance. And that means that what's happening physiologically to their body? Well, I'll tell you, blood flow is not getting directed into their digestive system. They're being shunted into all of their limbs. Their pupils are dilated so they can actually escape from that lion or tiger. Khalid, Shauna's can't see any of the, Stephanie can't see any of the slides, so. Oh, just go back. Okay. So there's no rest and digest happening when you're in fight or flight. And when you're in fight or flight physiologically, blood flow is getting shunted to your limbs. Nothing's getting directed to the core. There is no rest, there is no restoration. So we're not getting chased by lions or tigers right now, but we do have tons of activities for our kids to get to. We've got our bosses breathing down our neck. We've got meetings to go to. We've got physical stressors. We have digestive disturbances, anxiety, depression, the eczema, psoriasis, like I was talking about, brain fog, thyroid disorders. Those are our stressors. Those are our lions and tigers that are chasing us. And I will tell you, when you're in, oh good, it got solved. Thanks, Khalid. When you're in that state of fight or flight and you're trying to consume a meal, nothing is getting digested. So let's look at the next slide where we talk about the gut-brain connection. So nowadays, it's not, most of us know that there's this gut-brain connection. And that highway between our gut and our brain is the vagus nerve, which is a big central component of our parasympathetic nervous system. So it's a cranial nerve. And it actually flows right down in front of the body here. And that is why when you take a diaphragmatic breath and actually activate the parasympathetic nervous system by activating the vagus nerve, you get into rest and digest. And so there is now not only evidence for gut-brain axis, but actually a three-way axis called gut, brain, and microbiota axis. So how many of us know about the microbiome? Well, the microbiome is the trillions, 100 trillion microbes actually exist on our body. They're in our digestive system, they're in our vaginal tract, they're on our skin, in our mouth, all over. And our bacterial cells actually outnumber our human cells 10-1. And the bacterial DNA outnumber human DNA 100-1. So these microbiome, these microbiota, the bacteria, are very essential to our health. They actually make up about 90% of serotonin, which is our feel-good hormone. So serotonin, very powerful, important neurotransmitter. So think about that. 90% of our serotonin, which is our feel-good hormone, is made in our gut. Our gut actually houses 70% of our immune tissue. So immune system right now, that's a really hot button topic, how we can boost our immune system. Think about the gut, because 70% of our immune system actually lies within the gut-associated lymphoid tissue in our digestive system. And there is this direct link to our brain through the vagus nerve. So there is constant communication. If we go to the next slide, this is a slide that I actually, or a handout I actually show to the majority of my patients, leaky gut syndrome. So what does that mean? What actually happens when our body is exposed to viruses, toxins, bacteria, fungi, antibiotics, food sensitivities, which is a big area that I deal with? What happens when our body is influxed with this amazing amount of inflammation? Well, what happens is the cells lining our digestive systems that you'll see on our left here on the slide, that's our normal intestinal mucosal cells. Those are the cells lining our digestive system. They should be tightly knit together. Those are normal tight junctions. There shouldn't be a separation in between each cell. When there is inflammation, when we're assaulted with viruses, bacteria, fungi, antibiotics, food sensitivities, those cells become leakier, meaning that the cells now they're not tightly knit. There are no normal tight junctions. In fact, they're leaky and inflamed. Now, why does this matter? Well, actually the food particles, the virus, bacteria, microscopic now, remember that they're digested, so it's microscopic. They're actually seeping through the cell lining into the bloodstream. And why does this matter? It matters because our immune system reacts to what's in our bloodstream. So when they're reacting to these circulating immune complexes, inflammation results. Autoimmunity can result because our immune system is now being forced to deal with these invaders when they're not necessarily invaders. And how we can heal that is by healing the gut. So if we heal the gut, we immediately form a barrier to the outside world, the outside assaults, which can really be as simple as food sensitivities. If you remember nothing but one thing from today's presentation, remember that what we put into our bodies is the most intimate relationship that we're engaging in. Yeah, I said it. The most intimate relationship, because food is actually it's the only thing that goes internally within us. And it can make or break our health, all by our diet. So let's talk about some tips for not only eliminating well, but also eating well and repairing the gut lining. So the next slide touches on this. So remember I mentioned the importance of bowel movements. And yeah, I do talk about it a lot. I'm not squeamish about it at all. I know this might be breakfast, maybe an early lunch. So I didn't want to put a stool chart on there. I did have it on and I, in all honesty, removed it. But we need to eliminate well, because as I mentioned, your gut actually impacts your immune system, your hormonal system, and your digestive system, and your nervous system. So it's impacting multiple systems. we need to have regular elimination, daily bowel movements. So that's tip number 3, but let's go to tip number 1, which is diaphragmatic breathing to activate the vagus nerve. If you just go back. So diaphragmatic breathing, as I mentioned, when we expand our diaphragm, we are actually activating, massaging the vagus nerve. And that vagus nerve, if you'll remember, is the highway between the brain and the gut. So when that is activated, we get into parasympathetic nervous system, which is the rest and digest. The other option for activating the vagus nerve can be things like yoga, meditation. It can also be things like shaking. And if you can probably hear my dog scratching right now. Well, dogs often shake as a matter of releasing that excess stress. So we tend not to complete that stressful loop nowadays. So imagine your boss is calling, you're trying to get on a conference call, you're wolfing down your lunch, then you go home, your kids have activities, you're trying to make dinner. When does our stress stop? That gazelle traveling at 97 kilometers an hour, they either get chased and eaten or they run away and they're safe. We often don't complete that stressful loop, and completing that stressful loop is very important. And we do that by activating the vagus nerve. So there's multiple ways to do that. Remember I mentioned chewing thoroughly and not eating on the go? Also very important. Rest and digest. Again, if you remember nothing else, remember, activate the vagus nerve. The second tip is drinking water. So, I mean, obviously that's a no-brainer. We all know to drink water. We all know to drink enough water. But do you know how important it is? Because when I see patients in front of me, I would say 90% of them are dehydrated. So we know it, but we're not doing it. The other thing is that if we remember to drink water, we're gulping water. And that's not efficient at all because we don't absorb more than 2 cups at a time. So don't gulp your water, sip on it throughout the day, and separate it away from meals. We'll be talking about this in a minute here, but our own digestive enzymes get diluted when we're drinking water throughout a meal. So drink water, but make sure that it's the right amount consistently throughout the day and separated from meals, and also that it's room temperature. We actually use a lot of heat and energy warming up the water, which takes about 10 to 15 minutes in order for it to get absorbed. So we can mitigate that by drinking room temperature water. If you've ever drank really cold water from a water bottle and gotten on a treadmill, you can hear it kind of sloshing around. That's what's happening. It's not getting absorbed till it warms up. And then the third and final point is regular elimination. Daily bowel movements, and if not, multiple times a day. If you're eliminating 1 to 3 times a day, you're doing great. If you're eliminating after each meal, you're doing fantastic. I see patients in my office every day that are eliminating once every 3 to 4 days. That is not appropriate, and that is a big indication to me that their hormones are off, their immune system is not functioning well, and certainly that their digestive system isn't functioning well. I had a patient who was head to toe covered in hives and eczema, and she had been to multiple doctors, multiple dermatologists. We went directly to her gut, and I found out that she was one of those patients that was eliminating once every 3 days. And I knew that something was off. So it's a big clue for me, and now it should be for you. Are you eliminating well? Are they easy to pass? Are they formed? Use the Bristol-Myers stool chart. Again, I didn't include it here because it might be breakfast or early lunch for you, but look at that chart. And if you're a normal range around a 4, you're doing okay. If you're off, you need to maybe be seen by a naturopath, maybe be seen by an integrative medical doctor, and get to the root cause, which is often your gut. Khalid, if you go to the next slide, we'll talk now about healing the gut. So we learn about 4 R's to heal the gut pretty much in year 1 of naturopathic school. It is a foundation, fundamental tool that we learn because as we've learned here today, the gut really is the basis for most bothersome symptoms, most chief complaints, because it impacts multiple systems in our body. So the 4 R's to heal the gut, there's really 5, but we'll get to that. There's 4 R's. Remove the irritants. Remember I mentioned the leaky gut syndrome and the food sensitivities? What are your food sensitivities? I'll tell you the big ones are dairy, gluten, yeast, caffeine, alcohol, and sugar. So all the good stuff, right? But they might not be necessarily bad for you. So what are your food sensitivities? What I do for my patients is either put them through an elimination challenge diet, which you can learn more about on my website, or you can do a food sensitivity test where we take the patient's blood and actually look for IgG, the immunoglobulins, the immune complexes that are being formed to particular foods. Right away, you get a report of what your particular food sensitivities are. So you want to remove those irritants. Number 2, the second R is replacing insufficient digestion. I talked about digestive enzymes. Are your digestive enzymes functioning well? If you sit in front of me in my office and I'm asking you about your bowel movements, I'm asking you, do you have undigested food in your stool? And you say a resounding yes, this is you. You need to replace your insufficient digestion, which is replacing your digestive enzymes or helping them function optimally. They function optimally in an acidic environment. And that's why often doctors are recommending lemon juice and water, warm water at the start of the day, or apple cider vinegar. So that's where that comes from, to replace your insufficient digestion. Number 3, or the third R, is re-inoculate good flora. This can be probiotics, a probiotic supplement, or fermented foods. I myself did a report in school, I remember this way back when, comparing fermented foods, eating fermented foods, to taking a probiotic supplement. So notwithstanding if you have an inflammatory bowel disorder, you might need a much higher amount of probiotic supplementation. But if you are in the majority of the population, you might do very well with fermented foods. So kombucha, kefir, kimchi, sauerkraut, sourdough bread, a good source. Those are all fermented foods that you can eat regularly on the daily and re-inoculate your good flora, contribute to your microbiome so that you're not in dysbiosis. There isn't an imbalance between the good and bad bacteria. You can also take a probiotic supplement and make sure it's from a reputable company and doesn't have a lot of excess emulsifiers and fillers in it. The fourth R is to repair the gut lining. So like we talked about leaky gut, we want those cells lining the digestive system to be tightly knit. And the food that feeds those cells to heal the gut lining, one of them is L-glutamine. L-glutamine is an amino acid that helps to heal the gut lining. There's also curcumin that helps to bring inflammation down, omega-3 fatty acids. All of these will help to repair the gut lining. And there's multiple powders, supplemental powders that I recommend to my patients. I'm not affiliated with any companies, but Designs for Health makes a great GI Revive powder that has L-glutamine and a number of other support systems in there, support supplements to help to repair the gut lining. The final thing is relax. So 4 R's, this is the 5th R, and I include it because it's very important. You want to get out of sympathetic dominance, where all you're doing is being in fight or flight. You want to relax, because when you relax, you activate your vagus nerve. And when you activate your vagus nerve, you're getting into rest and digest and actually absorbing the nutrients, the multitude of benefits that you're getting from the foods that you're eating. And if we go to the next slide here, so we talked about the 4 R's, which was really important, but remember that there's actually 5. The 5th R is to relax. And the relaxation actually is very important because it helps us get out of sympathetic dominance. What happens when we get out of sympathetic dominance? We are then out of fight or flight and into rest and digest. And again, if you remember nothing else, remember that diaphragmatic breathing actually massages and activates the vagus nerve, which gets us into rest and digest. And why that's important? It's because of the gut-brain connection, the gut-brain microbiome connection, and the impact that it has on our hormonal system, our immune system. Remember, 70% of your immune system is in the gut. 90% of serotonin is made in the gut, so the impact on the nervous system. The gut is usually the root cause of multiple disease states and multiple most bothersome symptoms that I see so many patients suffering from, whether it's brain fog, hormonal imbalances, eczema, psoriasis, and digestive disturbances. So I show my patients in front of me, and I love all of you that are tuning in today. Hi, Leslie. The healing triangle is very important, and what I fell in love with when I learned about naturopathic medicine. I don't know if this got cut off, but I am a patient. I suffered with ulcerative colitis since the age of 19. I've actually lost my colon and gallbladder, so I have a much compromised digestive system that I work with on the daily by making sure that I am putting in good foods into my body. Remember, the most intimate connection is the foods that you put into your body. My gastroenterologist 15 years ago told me that diet plays no role in your GI symptoms. Absolutely nothing. We now know that that is wrong. And 15 years fast forward to today, diet plays a big role. The other thing that plays a big role is our mental, emotional health. And that's what the healing triangle shows: physical, mental, emotional health. And we want to be in the center, balanced. Our center of gravity is balanced. We're often pulled in one, two, or all three directions so that we're off balance. And what I do for my patients is work from least to most invasive, using the tools of treatment modalities at my disposal: acupuncture, herbs, supplements, IV therapy, diet, nutrition, to work to a state of harmony and balance by treating the entire person: physical, mental, and emotional health. So remember that health is a state of body. Wellness, though, is a state of being. And I want all of my patients to experience total vitality and total wellness. Thank you.
Back in there. We appreciate having you here. One other thing that we want to do is have Dr. Shahana Alibhai come on. She's a stress and anxiety expert.
Good morning, everyone. I'm so happy to have a chance to be part of this great webinar. Just to introduce myself, my name is Dr. Shahana Alibhai. I always like putting up the slide because I think when I do introduce myself, yes, I'm a family doctor, but right now I'm 99.9% under the age of 5. They're a little bit older than what's in the picture there, but they still really are my full-time job. But my passion, I have to say, is public speaking. And somewhere along the way, what I enjoy speaking most about is really mental health. And if I had to sum it up in one word, it's stress. Maybe it's because I'm always trying to find ways that I myself can deal with stress and anxiety. But it's a most authentic topic for me to speak on, and I'm happy to speak with you today about it. This is the pyramid, I like to call it, the optimal health pyramid that I designed. And I think I designed this really out of frustration. I see so many patients in my office, and one of the difficult parts is that we have such a limited amount of time that we can spend with our patients. So a lot of the time, as you probably are all too familiar, when you see your family doctor, it's give me the symptom, jump to a diagnosis, come up with a treatment plan, typically involving medication, and you're out the door, typically within 7 to 10 minutes. But what happens often is that when I like to talk with my patients, I find out all of this other stuff. Talk about their family, their relationship, how they're sleeping, how they're coping at home, and even about their goals and dreams. So one day, actually, this is a true story, I just sat down, drew a triangle, and said, if I wanted to put everything I believe health was made up of, what would it be? And I came up with this. And the foundation for me, as it is for many of you, is our brains, it's our minds, it's healthy thinking, what I call thinking better. And probably the reason that this stuck with me most is because of that picture that I showed you just one slide previous. After the birth of my first son, Ishan, I suffered with postpartum anxiety, debilitating postpartum anxiety, in fact. And it took me almost a year to reach out and seek help. You know, saying those 2 sentences took me a year to actually say, and now I can say it with ease. But that took practice. That took recognition of the fact that I needed to take care of my mental health, and that's why it's on the foundation of our pyramid. Connecting deeply and building these strong relationships with your family, with your friends, with your colleagues is also there, because really you are the estimate of the 5 people that you spend the most time with. So you better have strong, nurturing relationships if you are going to be your best self. When it comes to decisions, I really quantify your health as a decision that you make every single day. You know, health is not necessarily a goal. It's not necessarily a habit. It's one decision made after the other. So when it comes to the decisions you can make for your health, it's how do you eat? How do you rest? How do you move? And I just want to say for a moment, when it comes to resting, I don't necessarily just mean sleeping. I mean, how do you rest your brain? How do you relax? Do you escape? Do you practice escapism? Do you turn on the TV, open that bottle of wine? Not to say that that's not a bad thing, but do you actually confront your emotions? Do you have time to process them? Or are you always putting blinders on? So how do you rest in the spaces within your mind? And last but not least is this idea of impact. I think this thing that binds us as humans together to feel like, why are we here? What are we doing? What is our purpose? It doesn't have to be one thing. It doesn't have to be this aha moment. It just has to be something that maybe drives you. What do you live for? You know, I work with many teens who often have a lot of challenges with their mental health. And when I ask them, you know, what do you live for? A lot of them can give me an answer. You know, they live for their little sister. They live for the fact that they want to be a social worker and help another youth who's going through the same problems. So it doesn't matter how old you are. A lot of us, if we dig deep inside of us, we know there is that shining light. So the reason I mention this is because here we are in this world right now, March 2020, April 2020, and in comes COVID. And COVID represents this feeling of loss for so many of us because it stripped us away from our normal daily habits and routines. And more than anything, with social distancing especially, it's taken away that idea of connecting deeply with others. And we just say, okay, stay home, keep your social distance. But of course, us as humans, we crave that social interaction more than anything. And isolation and loneliness were already at its all-time high before COVID struck. How do I tell a youth now that is feeling so isolated, perhaps even suicidal, that you need to isolate, right? We can't do that in those types of terms. So when I put the COVID on this pyramid, I blocked out connecting deeply, although there are many ways that we can still fortunately connect through social media. But I want to show that there are so many other levels on this pyramid that COVID can never take away from us. It can't take away our minds and how we process this. It can't take away our ability to rest smart, to meditate, to journal, to move. We're still allowed to go outside to get fresh air. And even our eating decisions, it can't influence that. And more than anything, it is actually, I think, strengthened a lot of people's contribution and purpose. We're seeing that amazing idea of the collective experience of going through a tragedy, but bringing out such amazing attributes in our fellow humans when we see these acts of kindness every day. So I show that there, that yes, we feel a loss for so many of the daily habit, rituals, and routines that we're used to going through in our day because COVID has shaken that up. But so many things, actually the most important, it can't take away from us. So I share this image to bring into context what I'm currently going through right now, or what my last week looked like. You know, COVID alone, life still happens. And for many of you watching, you still have daily difficulties that you're going through. It could be your health, it could be your marriages, it could be the health of your children. And that was the example for me. So my youngest, Rahel, is 8 months old. And over the last week, he became extremely ill. And of course, I've seen a lot of pediatric patients, but when it becomes your own child, I think you can become less objective. He became dehydrated from a lot of vomiting. He became lethargic and listless. And this morning, we actually took him to pediatrics to be assessed by the team there. So watching your child, who's only 8 months, slowly deteriorate over the course of a week brought in so much anxiety for me. But when I really dialed into what I was most anxious about, it was wearing this dual hat as a doctor and as a mother. Because as a mother, I needed to be there, you know, hands on deck, caring for him, nursing him, doing whatever, you know, all parents do. But as a doctor, there was that constant fear, that constant guilt of missing something. So it was that uncertainty that was killing me inside. And I recently heard something that really stuck with me, and it was around COVID. But it was the fact that when you pair fear, which COVID sets in all of us, with uncertainty, this idea that when is this going to end? Is this going to affect my family? Is someone going to die of COVID that I know? All of these different things, that fuels anxiety. So it's the uncertainty more than anything that is so toxic to us. Another job that I work at is I work at the Abbotsford Breast Health Clinic, where we are on the front lines of diagnosing breast cancer. Now you can imagine how much anxiety, how much fear goes into the diagnosis or the lead up to the diagnosis for breast cancer. But one of the things that's always struck with me is this, that when I break the news to the woman and their family that yes, her results have come back showing that it is a breast cancer, of course, that's very difficult to digest. And of course, there's tears and there's high emotion. But I would say 90% of the time, the woman or the family looks at me and they do this. Okay. Because the week to 10 days leading up to the results was all unknown, was all fear, was all uncertainty. And however difficult that diagnosis is to make, at least then we can have a plan. So what I'm trying to highlight is that it's uncertainty that is the toxic driver of anxiety. Anxiety doesn't have to present as panic attacks. It doesn't have to present to someone saying, I feel really anxious. It can present in so many different ways. And now that you're in close quarters with your loved ones, you might see these different emotions coming up, and you probably recognize them in yourself. Fear, anger, overwhelm, guilt, irritability, apathy. You know, just me alone in the diagnosis or waiting for Rahel to hopefully get better, my 8-month-old, I felt so many of these things. And that's just a childhood illness. So remember, anxiety doesn't have to present as what we think of as typical, I just feel anxious. All of these things can be hallmarks for someone who's feeling very anxious. One of the things that I like to stress when I give this talk, and this is purely because I'm working on this myself, is what does it mean to be self-aware? So if I flip back for a second, even recognizing that you have any of these symptoms, fear, anger, overwhelm, that's a good step because you've recognized that in yourself. So many of us just drink the glass of wine or put on Netflix or do all of these things to cushion and band-aid ourselves without actually taking a step back to say, wait a second, like, how am I actually feeling? And if I had to put a word on it, what's that word? I'm scared. I'm overwhelmed. I feel really angry right now, whatever the case might be. That act in and of itself is self-awareness. And Dr. Brené Brown, who many of you probably have heard of, PhD, one of the most famous TED Talks out there. If you haven't watched her TED Talk on vulnerability, it's amazing. Just search Dr. Brené Brown. She says self-awareness is the developmental milestone of your middle age. And I love this. So just like we want our kids, I'm going through that right now, crawling and walking up the stairs and all these developmental milestones that we want our children to reach between your 30s and your 50s or your 60s, the developmental milestone of middle age is self-awareness. That one thing, being able to label and identify your emotions. And the reason you do that is that you can see a pattern. So that you can see, well, every time I feel blank, I do blank. Every time I feel angry, I do whatever, you finish off that sentence. Every time I feel really scared, I tend to whatever that sentence might be, okay? And oftentimes it might not be you, it might be your partner that can recognize your own patterns. This all sounds very well and good, and it takes a lot of introspection and self-awareness to even understand what your patterns are. But there was a missing piece for me, right? To admit to someone, to admit to my husband, to admit to my family, to admit to my friends that I was even feeling depressed or guilty as a mom, or any of those feelings that I had, that was really hard. And the reason it was hard is one word: acknowledgement. In order to become self-aware, you need someone that is trusted, that will acknowledge how you're feeling. They don't need to say that what you're feeling is right. They don't need to concur with that emotion. They might actually disagree with how you're feeling, and that's okay. But they at least need to acknowledge how you're feeling. Because if I go to my husband and say, I feel like a really bad mom, I feel really guilty, he might just say, no, you're fine, you're fine. But if he takes a moment and says, oh, I hear you, it sounds like you're feeling really guilty, suddenly I can take a step back and say, yes, that is how I'm feeling. Because he or she, or whoever you want to open out to, has created a safe space. If we don't feel safe in acknowledging our emotions, we can never be self-aware. So finding someone, even yourself, that you are allowed to experience that emotion and not just have to autopilot fix it, is one of the key steps in being self-aware. Now, here you are in close quarters with everyone. And I just told you on the foundation of the pyramid is that I want you to connect deeply with others. Well, one of the best ways that you can connect deeply with your spouse, with your family, with your friends, is to acknowledge them. But how do you acknowledge them? Let me teach you. When I was in medical school, this is, 4 years of undergraduate, 4 years of medical school, a few more years after that of training. Probably one of the most important things that I ever learned were 3 words. They have nothing to do with a medicine. They have nothing to do with a diagnostic tool or criteria. But it was actually a communications class in first year medical school that we actually got to sit down with members of our community. And they would teach us how to talk best to patients, because they were patients themselves. And there was an older woman that sat down with us, and she told us, she said, you know what, every time she sees her doctor, she just feels so heard. She feels so understood. And the reason she felt this way were because of 3 simple words. It sounds like. It sounds like you're feeling really tired today. It sounds like you haven't had much time for yourself. It sounds like you're really scared of how you're going to support yourself now that you don't have a job anymore. It sounds like you're bored. It sounds like you're lonely. I use this 99.9% in all of the shifts that I do, whether it be at youth clinic, whether it be at the breast health clinic, because this is so powerful, these 3 words. And it doesn't have to be scripted. It doesn't have to be clinical. But Khalid and I, of course, we're married. We use this all the time with each other, because sometimes you don't know what to say. And sometimes you're scared to assume how the other person is feeling. But when you mellow it with, it sounds like you had a really rough day at work. Do you want to talk about it? It sounds like you're really frazzled with the kids. Here, why don't I take them for an hour? Suddenly, it softens how you're feeling. It sounds like, for me, that is gold. And it sounds simple, but I really encourage you to use it when you're talking with somebody that you love. Because right away, you can take the emotion out of it and you can put the thought back in it. Another simple way to acknowledge someone is this. Here comes a fast food picture. So I learned this in a parenting book, because I'm now having parented 2 toddlers and about to parent another one. A key way to de-escalate a tantrum by a toddler is called the fast food rule. It sounds funny, but what do you do when you pull up, when you order in through, I haven't done this for a long time, but when you order takeout, I guess, and they repeat the order back to you. Okay, so you want a burger, a side of fries, and a large Diet Coke. Do you notice that they always repeat your order back to you before you go to the window where you actually can pay and pick up your food? They always say, so you ordered X, Y, and Z. They always repeat it back to you. So this little rule is called the fast food rule. So anytime you're trying to acknowledge somebody or you feel like the emotions are getting high, you simply repeat back what they just told you. So if it's a child and they say, I want a gummy bear package, or I want some more Smarties, instead of saying, no, you already had some, you just repeat it back to them. You want more Smarties. You want more candy. You want to watch another Paw Patrol, or whatever the case might be. But guess what? You can use this in adults. You really want more time to yourself. You really want a chance to whatever blankly blank it might be. Fill in the blanks. Repeat back whatever the person has just told you is one of the most powerful tools in acknowledging that person. It's that funny analogy of, let's say you take a photo of a group of people and you get shown the photo. Who's the first person you look at? Yourself. We all do it. You always look at yourself first in the photograph. And that's the same thing. When you can have your wants and needs repeated back to you, that's the sweetest sound you're ever going to hear. You want to acknowledge somebody? Try the phrase, it sounds like, finish off that sentence, or repeat back to them exactly what they said and watch their emotions come down. And reminding ourselves that the reason we're talking about acknowledgement in the first place is because when you can acknowledge yourself or someone else, that is the cornerstone to self-awareness. I put in this picture because so many times during this COVID crisis, we don't know what is to come. And that partly speaks to the uncertainty. We don't know what is to come. All of those emotions of fear and anger and irritability might bubble up and be on the surface at some times, or at other times you might feel like you actually are drowning. So there was this great quote that I recently heard by Dr. Vivek Murthy, former Surgeon General, and he said this. He said, remember your anchors. What are your anchors? Your anchors are those things in your life that nobody can take away from you. Your brain, your education, your past experiences, your faith, and most of all, your family and your friends. These are the people that know you even when you don't know yourself. So amidst all of this, it is more important than ever before to connect deeply, to acknowledge one another, and to have that time and that space to really cherish our relationships. Because once this COVID will go, and it will pass, what's going to be left are your anchors. So never forget to cherish them. Thank you.
What I want to open this up to are some questions. This is the time to ask myself or Dr. Shabita, Teja, anything that you want. And if it's something personal you don't want to message, we will answer questions over email as well. But if you've got a question that you have, please share it in the chat box right now. Shabita, that was an awesome presentation. And I love how you just made it so easy for us to understand. I didn't know that having more than 2 cups of water at one time was actually kind of counterproductive, because I'll just kind of take all my water at one time and then just assume that I'm hydrated. And that for me was a big take home. We got some questions here.
Yes. So I had answered what was the elimination chart you mentioned? That's the Bristol-Myers stool chart. So again, I didn't include it here because it's around now close to, early lunch. But look at the Bristol-Myers stool chart and compare what your stool looks like. This is the other thing. A lot of patients say, well, I don't know, I just flushed the toilet. I'm sorry to say this, but turn around and look, because the way that you're eliminating is the way that you're thriving. I'm telling you, elimination is very important. So compare what your stools look like, because a lot of times they're not easy to pass. They're not formed. You do have some mucus. You do have lots of undigested food. At least that's what my patients tell me. And when we heal the gut, we heal a lot of symptoms. And it doesn't just have to be digestive symptoms.
Yeah, thanks. I think that's just so powerful. Even when I think about what we're going through right now, there's a lot of uncertainty, and we're in a crisis, but also, we're going to get past this, but we're also in a crisis right now of our own healthcare system. And that's not going to change 90 days from now. So it's up to us to stay informed. I really think about the stat that I gave earlier, is that lower back pain is the #1 cause of disability on this planet. Can you believe that? It's the #1 cause of disability on this planet. So I think we really need to think about how are we moving every day. It's not go to the gym for just an hour and hit it hard. It's studies have shown, like, you're proven to live longer and have a healthier life if you just get up for 2 minutes every 30 minutes. So if you can just remember the 30 and 2 rule, and then when you're using the washroom, look behind you, right? It's actually telling you what's going on inside of your body. Like, you don't get a better sneak peek than that. Shabita, was there anything else you want to leave everybody with? Again, Dr. Shahana Alibhai, our stress and anxiety expert and family doctor, is taking care of a sick child right now. So she's going to record her session later, and we'll make sure you get the link. Shabita, any closing comments?
Yeah, I will say, so that's my sister, right? And I'm very worried about my nephews at the moment too, but you have to listen to Shahana talk. She is fantastic, probably better than both me and Khalid combined. So we'll get her to record her section. She talks about resiliency. She talks about fear and anxiety. She has dealt with that herself with postpartum. And we know we're such a tight, closely knit family. So when I've gone through my issues, the family goes through it. And same thing with Shahana, same thing with all of you that are tuning in today. So share this information with your friends and family. I know, Michelle, you asked any tips for getting rid of lichen sclerosis. There are tons of tips. I would urge you, I've included my email in the chat group here, shabita@tejawellness.ca. Email me individually, because it really is, like many things, an individual concern. But I would say, look at the gut, look at yeast, look at fungal overgrowth, look at the abrasive possible detergent soaps that you're using. So heal from the inside out and from the outside in for many conditions, but more importantly, skin conditions. I had a patient who was head to toe covered in hives and really bad, almost crocodile skin type eczema on her back. She'd seen dermatologist after dermatologist, been to actually a few naturopaths, had come to see me after 1.5 years of suffering. We healed the gut using the simple 4 R's, 5 R's if we want to include relax. And she, within 3 months, had a clear bill of health. So this can actually happen. I have seen it time and time again in practice. So really, when I say heal the gut, it's not a flippant remark. Go back through the presentation. You will get a recorded link. Listen, go back through the 4 R's. And if you want more individualized help or information, simply shoot me an email. But thank you so much. It was such a pleasure to be part of this webcast, this webinar. Thank you, Khalid, for organizing it and for sharing your valuable information on moving well. This is a difficult time. We want all of you to thrive.
Way to go, guys. Power to you for tuning in. You're the ones who are going to benefit, and now go do something with it. Take care, be well, and be great.